Good afternoon. Good afternoon. Hi, Councilwoman. How you doing?
Pretty good, Councilwoman. It's always a pleasure to be around and having a great conversation with our Councilwoman.
Wonderful, wonderful. It's a pleasure to see you. Happy Tuesday. I'm so excited to be doing this Facebook Live with you. And definitely, I want to welcome, as we give a few folks a couple of minutes to join us and to get on and get acquainted. I want to welcome every woman and even men that are joining us this afternoon for a great conversation. Definitely, this is a kickoff to our Hear Her campaign, where we're going to be focusing around maternal health for women in our communities, from Newark all the way to Orange to Irvington, all of the local areas, talking about maternal health for our constituents and our surrounding constituents. So I just want to welcome everyone. Definitely feel free to use the chat. Feel free to tune in and join this conversation, which we're looking for to be a very interactive conversation. So definitely, if you have any comments, we're looking forward to seeing your comments in the chat, and definitely taking back some of those comments as we continue to have these very important conversations. So welcome, everyone. Welcome, welcome, welcome.
Definitely, Councilwoman. For those of you who are just joining, my name is Charnette Frederick. I'm the Councilwoman from the Township of Irvington. When we hear about the health, when we hear about our concern, hear her concern, it's very important. And being an ambassador for this organization, it's an honor. I'm looking forward to provide a lot of information for, as you heard our Councilwoman, that it doesn't matter who you are. All of us has to get involved to hear her concern. So looking forward, we're going to have an amazing conversation, huh?
Yes, yes. And I failed to announce that I am, of course, Central Ward Councilwoman LaMonica MacIver, and I represent the great Central Ward in the city of Newark. And as my wonderful Councilwoman colleague said, we're definitely looking forward to passing along information, bringing much awareness to maternal health issues, as well as women issues altogether, women health issues. And definitely, it's such a great, a great time to be with my council colleagues to be able to discuss these things, because even though we're from two different municipalities, definitely these issues are issues widespread throughout all municipalities and from state to state within our country. So let's go ahead and jump into conversation. What do you say, Councilwoman?
Definitely, as we start our introduction, it's important to listen to her, to hear her concern. For most of us around, it's, certain sign might be simple and easy. But however, for a pregnant person or for somebody that already give birth, it's very important that we pay attention. And I know that you're gonna have the link on some of those warning signs, but perhaps we can talk about it based on our experience. For those of you who do not know, I have a child myself, a son. He's 16 years old, but
Wow.
as a mother, I see the needs to make sure our women listen, because the sign within our body is very important to know, because it's not the same. We are concerned so much about how, the baby, or, after we give birth, or even prior to give birth, our whole body change. And as a result, we forget about our own self. And when I heard about this partnership, it was an honor again to be part of this, because the more that we can educate our women, our mother, our grandfather, our grandmother, our friends, our father, about how to listen to our mother is very important. So I am so grateful to be part of this, to talk about my experience. And perhaps, Councilwoman, you can talk about your experience as well as we go deeper to the conversation.
For sure, for sure. So first of all, 16 years old, wow. I feel like I'm a newbie parent compared, a newbie mom compared to you, because my daughter is literally 6 today. Today is her birthday. And it feels like it was just yesterday of having her, and just being, pregnant and going through the stages. Definitely, it's just it's unbelievable to know that she's 6 years old today. But definitely, I agree. Just thinking back to my personal experience, to, getting pregnant and, carrying my daughter and all of the different issues that I had to face during that time. And just also being aware after delivery of, listening to my own body, listening to my own self, how I'm feeling emotionally, physically, all of those things were definitely important. But it's hard to focus on those things, just like you said, when you're just focusing on the baby. Everything is that baby, trying to make sure that baby's okay, that baby's fed, that baby's changed. It's really hard for us to take a moment to step back and think about ourselves in that moment, right? And so definitely trying to encourage women to worry about themselves, to make sure that you're checking on yourself, having some self-care during that time when you're trying to take care of that baby is definitely important. So I have a question. So thinking back at 16 years, I know that's quite a while ago back, but is there like memorable moment you can think about when you were, pregnant, during your time of carrying?
Oh, definitely. One of the key thing I remember, prior to have a baby, my husband and I, we think very hard, are we going to have a baby? And one of the key thing I wanted to give the best for my child. And part of it is also breastfeeding and make sure that everything around it is as natural as possible. And that comes with a lot of stress. That comes with a lot of worry, because you might have your plan, you might be ready, but at the same time, that doesn't mean things goes your way. But one key thing we wanted to tell our mothers and our fathers is you're not alone. We have a whole organization, want to hear from you, hear your concern, understanding the problem. It takes a village to raise a child. I take that very dearly. Back in Africa and everywhere else, it's not only one person that take care of that child, that take care of that mother. It's all of us. And this is one of the key things that I'm grateful for, hear her concern, because it gives us the platform to let the mother and the whole village concept that you're not alone, that we are ready to listen and then encourage others to listen to our mothers. So what does that mean? All the stress, all the worry, don't be afraid to talk with someone. And I'm pretty sure with this kind of conversation that we have in Councilwoman, that people are not afraid to talk to each other. They are not afraid to let them know their concern, because we know it's hard time. And as a result, even though I gave birth 16 years ago, guess what? I constantly talking to our mothers, constantly talking about to them, to let them know it's never a failure, even though certain things not goes your way, with all the concern and the worry. But the most important thing is take care of yourself and take care of your mental state to make sure that we all are on the same page. You know what? As I'm listening, having your daughter 16 years old today and on the call, how important is this for you? Not only you taking care of your daughter, but at the same time, it's not robbery to teach others the importance of listening to each other.
For sure, for sure. Definitely. I can attest to the idea about the breastfeeding. Oh my God, I felt like such a failure, as a mom when I wasn't able to breastfeed and I was just having a lot of difficulty, the stress of that. Definitely. We need a session just to talk about that all together. Just breastfeeding and the stress of that. So we do have a question in the chat. This conversation of how it's just full circle of having this conversation on my daughter's birthday, Councilwoman, is definitely, it's just ironic, right? To have this convo with you on my daughter's birthday, but definitely one that's definitely needed for our folks that we serve, our women that we serve. So we do have a question in the chat. And the question is, when you are pregnant, your body goes through so many changes. Yes, definitely does. How do you know what's normal and what you should be concerned about? I guess I can start with that. For me, being a new mom, I did a lot of reading, right? I feel like, us as moms, we kind of have to take the time to read, research, speak to our doctor, make sure we are having that prenatal services that we need very more than anything, right? Talking to your doctor about what to expect, what not to expect, having that list, doing your research. Even just on social media, if you're a big a parent that's big on social media and you like to, look at Facebook and follow different groups, there are a lot of great groups on Facebook and Instagram, different social platforms where they're constantly talking about a lot of different challenges, what to expect when pregnant, and all of the different stages of pregnancy, right? What to expect in your first trimester, what to expect in your second trimester. And those platforms are great tools to be able to help guide you on what to expect, but definitely nothing beats speaking to your healthcare provider and getting the right information, right? Asking all of the questions. No questions are dumb. No questions are not expected. Just taking the time to really ask all of the questions you want to ask, because so you're very clear on, what to expect. I think anytime when you're not feeling yourself, you're not feeling, happy, you're not feeling healthy, those things are just your body speaking to you from a mental perspective, a physical perspective, and even an emotional perspective. As a, pregnant woman, I think when you're not feeling up to par, then those are things that you have to take seriously. But definitely, one is speaking to your healthcare provider, and two, definitely, listening to your body, right, of how you normally feel versus now, and not taking anything lightly of saying, oh, that's nothing, I got a little stomach ache, oh, that's nothing, or a headache. Everything you should take serious, and, pick up that phone and call the doctor and tell them about how you're feeling.
Definitely. I don't think I can say it any better, Councilwoman. As you're saying, every woman or individual, every sign is individual. As a result, do not afraid to talk to your healthcare provider. But the most important thing, do not let people make you feel like, oh, it's nothing. It's normal. Normal for you might be different for normal for somebody else. With that being said, unless that you really take care of yourself, listen to yourself, talk to your healthcare provider. That's the most important thing. But the most important thing as well too, understanding how you feel. Sometimes for me, I write down. You know what I mean? I write down how I feel. Keeping a log of how you feel also helped out when I was pregnant. Meaning, for example, I don't have to remember when I go to my healthcare provider, I know the sign that I felt and how I felt, depending on how I eat. Sometimes the food that you eat make a big difference as well. So
Correct.
It's important that you are aware of your body, but the most important thing, talk to your health provider. One key thing I want to add, let's say you speak a different language. Remember, you're not alone. For me, I'm Haitian American. I'm so proud of it. Speaking a different language, it's important to remember you're a human being. We want to reach out to you, knowing that all of our Sign Hear Her campaign is a different language, because we want to hear a woman. We want to tell you, we have different people that can translate all different ideas that you have within even the healthcare provider, that they will have different people that speak your language. With that being said, do not be afraid that you cannot, state it in English in order for you to state how you feel in your body. But the most important thing, remember, we are here to hear you. But guess what, Councilwoman? I have a different question for you. What are some of the warning signs that the Hear Her campaign highlights?
So I think, first of all, thank you for your comments. So that is very, especially talking about being, having a language barrier. That is something that we see people shy away from all the time. No matter what topics we're talking about, they're shying away from not being comfortable with being able to speak about the different issues. So definitely don't feel like that or let that be a barrier for you. I think the Hear Her campaign is definitely going to focus on a lot of different warning signs. Some of those things where you talk about like severe headaches that you may have, overwhelming tiredness, because we know how pregnancy, you're making a whole human being, definitely can make you tired from time to time. And sometimes that tiredness is overwhelming, fever, dizziness, and other symptoms that could be a sign of pregnancy complications or postpartum infection. So definitely the Hear Her campaign will focus on many of those things, talking about those different, warning signs. And the Hear Her, provides easy to share information as well. We're looking to give you information that's going to be helpful, that's going to possibly save your life, right? Or save your baby's life. So definitely talking about some of those things is going to be, very important for us to, focus on and tackle in the Hear Her campaign.
Definitely, Councilwoman. As always, I always say, I'm there for the voiceless. I'm there to support those of you who do not think they have the language. Keep in mind, I have friends who are Spanish. I have friends with different languages. So don't be afraid to really listening into your body. And as you heard from the councilwoman, that they have sign, some sign with either an infection, some sign with either that there's a problem. I know usually regular person might have like a fever, but for you, if you just have a baby or if you're pregnant, pay extra attention to those normal, supposedly normal signs. This is a little bit different. We want to save you, save your body, and save, and remember, you are important. You are the most important things within that whole Hear Her campaign. With that being said, let's continue to hear her campaign. Let's continue to educate our everybody regarding the message. As you heard, I think we had an amazing conversation so far. We are gonna be there to support as an ambassador of the Hear Her campaign concern, because it's very important for you to be in the known that we are around for you. I don't know if you have the last word, Councilwoman.
Well, I did see another question come through in terms of, how can your support system be helpful to you? And I think you touched on it earlier, Councilwoman, in terms of just knowing that it takes a village, right? It's not on just you. You have to call upon your village. You have to call upon your support. I know for me, when I, had my daughter, if it wasn't for my village, my sisters, my mom, I would I don't know where I would be. I mean, I still don't know where I would be today working a job as a public servant, but definitely, getting help, when it's, you need help with, someone watching the baby while you take a shower or prepare, all of those things when you just need a mental break, right? When you just need to go places or you need advice on, hey, something's happening. It's this woman that I know in our community. She's actually like my personal mom, but she was a caretaker for my daughter. And she's my best friend's mom, but she's a retired nurse. And I mean, anytime I had an issue, I'm like, hey, can I give this amount of dosage? Can I do this? Can I do that? This is happening. I mean, literally, she was like a sounding board for me, a personal person that I could pick up just to get advice. And it doesn't have to be a retired nurse or someone. It can be a mom, someone else, your mom, a grandmother, whoever, a friend that has children, where you can just call and use them as support to talk with them about like things that are happening, maybe about how you're feeling, maybe about things that are happening with your baby, to be able to have someone to be able to talk to and get some support. And so definitely don't feel like you're less than if you have to call on someone, friends or family, for support. Like you have to be, feel free and feel comfortable with being able to get support from someone else, because you can't do it alone, right? You have to be able to call, upon folks to be able to help you, because that's what it's all about. I think that definitely our community, our surrounding community, has to listen to women, right? Listen to what's going on with us, listen to how we're feeling, listen to things that are impacting us as a whole, especially around maternal health. And definitely like the men in our communities, right? Being able to be supportive to, women in all factors, right? But especially with our health, especially when we're trying to create life and being able to, take care of that child that comes after that creation period, which is, definitely a task all by itself. So definitely, having the community listen to women, be supportive of women in all factors. So I think that this conversation has been great. Definitely, there are lots of other topics for us to be able to discuss in our Hear Her campaign. So we hope that everyone that joined us today, that you will be back and you'll be able to participate as we bring, fresh people to this platform to be able to speak with us as well. It's not just about the councilwoman and I, talking about our experiences, but more so bringing others involved in this conversation and having a healthy conversation with our community folks and you as well, participating in those conversations, because these are conversations that we have to continue to have and we have to continue to promote. And so definitely, tell a friend about the Hear Her campaign so that they can get involved. And the campaign can be helpful to them, because it is resources, it is being able to guide you, as you are, pregnant or expectant or have had a baby, to definitely serve as a support social group for you. So I just want to thank you, Councilwoman, for jumping on this. I'm looking forward to continuing to have this conversation. Definitely to the Partnership for Maternal and Child Health for hosting this and definitely having us as Hear Her ambassadors. And definitely looking forward to, our next chat, right?
Definitely. It sounds like we can speak for hours, Councilwoman McIver, because this is so important to us. When we hear about the health of a woman, we are we take this to heart. With that being said, I am so grateful for each of you who listening to us right now. I heard we might be the first as a pioneer councilwoman, but at the same time, we know we're not going to be the last. You're going to hear a lot of voice, from our community leaders and council people to encourage, the importance of Hear Her campaign. So looking forward to continue the conversation. And if you need any information, you know where to go to the link, and you can always reach out to us because we want to hear you. With that being said, thank you so much for all of you who are watching, and I hope you enjoy the conversation we're having. And thank you for the opportunity for us to speak on this very, very important topic.
Great. Thank you. Thank you all. Take care.